I got to ask, why you have a choice to go around the country and pick one topic, why the implant-occlusal connection? I just think it's the hottest topic in dentistry right now, and so I think it's a wonderful way for us to be able to talk about the things we do at the Dawson Academy and how the principles that we utilize with teeth apply so well to the implant side of what we do. I do think the most important thing in this economy and in any slowdown is to understand that patients still want the best, but often they are looking for ways to segment care. And so any time that we can take a moderately complex treatment plan and find a way to logically sequence it so that a patient can do the work over time, we can often find a way to have them chip away at it over a 3 or 4 year period where it doesn't cause a big stress in their life. Dr. Dawson has always taught the last thing we want to do is create more problems in somebody's life than the ones they have in their mouth. And we can do that very easily in dentistry by telling people they have to do everything at once. And so, one of the things in our curriculum we really work towards, whether it's a tooth-driven treatment plan or an implant-driven treatment plan, is that sequencing. And that's something that we will get into in detail in this class. Teeth have a ligament, and when a teeth have a ligament that holds the root of that tooth in, it gives it the capacity to adapt. So if an orthodontist moves a tooth too far out of that delicate corridor of neutrality between the pressures of the cheeks and the pressures of the tongue, the tooth will just move back in position. If we put in a crown that's a little bit high and the patient can't get right back to us, a lot of times that tooth will move within the socket and adapt. So the adaptive capacity of a tooth, by virtue of the fact that it has that ligament and it has mechanoreceptors in the dentin and around that tooth, allow it to talk with our masticatory system and respond in a way that implants can. So it's even more important, I think, when we get dental implants in the mix, that we get really, really clear where that final restoration is going to be and making sure that that implant is going to be put exactly right under it. So when we start functioning, the forces will go right down the long axis of that implant, and then when we start functioning and moving left laterally, that there isn't going to be any horizontal force on the implant at all. One of the things we get into a great deal of discussion about in the class is, what do you do when you have a single implant versus a quadrant of implants or a whole arch? You start looking at anterior guidance. What does that guidance have to look like, and how does that different than teeth? I mean, these are all things that I think are curious, and intuitively as dentists we know it has to be different. The great news is there's a lot of research that tells us what we should be doing, and thankfully there's technology we have today like the T-scan and JVA and other things, biometrics devices that allow us to see how the occlusion should really look based on timing rather than just dots on the teeth, that make us quite a bit more predictable with our day-to-day work with implants. But also tells us a lot about the joints as well. We can see a lot about whether the joint is in the right placement, whether it's actively breaking down, whether it's broken down and is now more stable. And then of course lastly, when we start finishing cases, the role of the T-scan when we start looking at the timing of the occlusion is something we'll get into, because one of the things that's really different when you start looking at implants versus teeth is because implants do not have that ligament, it's very easy for us with articulating paper to put the dots all the way around the arch and have what looks like equal intensity dots on those implants. But when we start looking at it with the T-scan, we'll actually think it's really carrying most of the load. So occlusal timing is a concept we're going to be talking about that I think is important, again, in adding predictability to the implant work we're doing every day in our practices.